Caring for a loved one with a significant illness or chronic medical condition can be challenging, and luckily there's a solution that offers patients hospital-level care with the convenience and comfort of actually being at home. And here to discuss acute care at home is Dr. Danielle Hanssen with Optum Health Washington. Welcome to New Day.
Thank you so much, Kelly.
Yes, so we often hear these words acute care, but we don't always maybe fully understand what that means, so if you can go ahead and explain.
Absolutely. So acute care is a specialty of medicine that provides urgent care to patients who require treatment, specifically for patients with active severe illnesses or flares of chronic medical conditions. This includes decompensated heart failure, respiratory illnesses like pneumonia or COPD, dehydration, you name it. The traditional model of this care has been that a patient is admitted to the hospital overnight, but acute care at home brings the hospital to the patient's home.
That's so awesome, and everyone always wants, if they can, to be at home. So what's the difference then between, home care and hospital care?
Yeah, so great question. There are actually more similarities than differences in that the treatment plan is exactly the same.
Interesting.
The differences come down to the patient is at home, so we bring the hospital at home, and by doing that, that decreases the risk of hospital-acquired infections. It decreases the risk of patients' falls. It also decreases the risk of something that we call hospital-acquired delirium, meaning that when a patient's admitted to the hospital, it's a new environment for them, so they're at higher risk for having disorientation and confusion.
Yeah.
And then overall, we've noticed that patients have high satisfaction ratings with being able to receive the treatment that they need at home.
Absolutely. And how is acute care at home delivered then to somebody at their house?
Great question. So it starts with a patient being referred, usually by an outpatient provider like primary care or a walk-in clinic, or even through the emergency department. The patient is then screened to make sure that they're eligible and that they have the appropriate medical conditions to be safely monitored and safely taken care of on the program. Thereafter, we coordinate the patient going home and getting all the appropriate equipment set up so that they can be taken care of and monitored closely. This includes a tablet through which the patient can interface with a provider or a nurse 24/7, as well as
That's like unheard of. Like I wouldn't think 24/7.
24/7. Just like in the hospital, but at home.
Right.
As well as the appropriate equipment to monitor a patient's vital signs like their heart rate, their blood pressure, in addition to an emergency response system. So if there's any sort of issues that come up, we can triage them in real time as soon as possible.
This feels like really personalized too, with like personalized programs for the patient. Do you feel like that as well?
Absolutely. It's very much so tailored and individualized to the patient.
Incredible. And how long are people in this program, and can they leave at any point? How does that work?
Great question again. So just like in the hospital setting, there's really no one size fits all. It really depends on what the patient is being treated for and how well they recover with the treatment plan. So typically about the same length of stay as being in the physical hospital. Additionally, we do ask patients to stay at home so that they're monitored appropriately and that they receive their care safely.
Amazing. Thank you so much for being here and sharing all this information.
Of course. If anyone's interested in receiving more information, they can find us online at optumwa.com.
Amazing. Thank you. And as Dr. Hanssen mentioned, you can talk to your provider to find out if you qualify for Optum Acute Care at Home, and you can also explore your family's options by calling the number that you see right there on your screen.
This portion of New Day Northwest is sponsored by Optum Care Washington.